Hello and welcome to Eclav Overseas. This is Purnima, and in today's video of MBBS Abroad, I would like to discuss the challenges that are being faced by the Indian students and what are the preventive measures that you should take to avoid such difficulties or challenges that comes into your way while you take your admission into MBBS in abroad. So every year, as you all know, thousands of Indian students, they are taking admission into abroad into various countries. So I would like to list down some of the popular countries where 90% of the students take admission. So those countries are Georgia, Russia, Armenia, Kyrgyzstan, Kazakhstan, Philippines, and there are many other countries like Mauritius, Malaysia, wherein usually students prefer. But 10% of the students, they would like to go in European Union side, and that would be maybe in Spain, Italy, Poland, Czech Republic, Hungary or Romania. So these are some of the popular countries in abroad wherein students will be getting the international exposure, as well as the studies are conducted in English medium only. Apart from these countries, there are some countries in Asia as well which do offers good quality of structure like China. But nowadays, students are completely avoiding China just because of the new NMC guidelines, which are exactly not fulfilled by this country, even in Philippines, which is not completely fulfilling the NMC guidelines. So this is the overview about the countries where 90% Indian students, they usually prefer going in abroad and to continue their MBBS studies in English medium. The course duration in every country will be 5 + 1 years. 5 years would be your MBBS and 1 year would be the internship. So within 5 years, after 3 years, the clinical rotation begins, and hence you can complete your clinical rotation including internship within 6 years of your MBBS in abroad. So now I would like to talk about the challenges that usually students face, because as per our experience, I can exactly discuss on the challenges that comes in students' way while choosing the university or deciding a medical, choosing a country, deciding a medical university. And there are many other challenges which are related to the admission process as well. So starting with the number one challenge that students face, which is like start from the beginning of deciding the country. Because there's too many confusion among students that which university they would want or which country would exactly fit into their criteria, as there are too many countries that I've already discussed in this video. So students will have such difficulty in finalizing the country, most importantly, as they will get to know too many consultants or too many agents who are describing the particular country. So they will get a lot of confusion in the student's mind. So here, what you can do is you can do your research yourself. You can search about the countries which are available, and most importantly, you should exactly know what your ambitions are, what you would like to do after your MBBS, because that will help you in deciding which country you should choose. Because there are some countries which are giving American curriculum, and then the students who are looking to prepare for USMLE or would like to settle in USA or Canada, then those students should have to choose those countries. And there are students who choose countries on the basis of the FMG passing rate, because they would like to come back to India, write the FMG or next exam, and they would like to practice in India. So you can choose the country when you would like to pursue your MBBS according to your goals, according to your ambition, and according to your budget as well. Because mostly non-European countries are offer MBBS within such a low budget or tuition fee, as well as whereas the other European countries, they do have a high budget or they have a high tuition fee. So you can also check the budget requirements. You can check if your goals are fulfilled by such country or not. Second challenge that students face while deciding the medical university. For example, if you have chosen Russia as your MBBS abroad destination, and now when we talk about the medical university, so there are more than 70 medical universities are located in Russia, when different medical universities you will find many Indian students are already studying in such universities. So now what criteria you can finalize here to decide whether which university you should choose in Russia or not. So you can talk about the budget, you can look into the FMG passing rate, which university is giving high FMG passing rate, which university is located in the developed city, which university has a maximum number of Indian or international students, which university has good clinical rotations, which university is successfully fulfilling the NMC guidelines or NMC criteria. So you can consider all such factors so that you can better decide which medical university is 100% fits in your criteria. So the third challenge which I am going to discuss here is the budget of the medical university, because these days you will find too many websites, too many consultant websites wherein you can find the different packages of universities. So here the confusion begins, and when students search those websites, and they will find the package for one single university differs into different websites. So just to avoid this confusion, you just need some preventive measures for all these challenges that I have discussed. So the number one preventive measure you should consider here is just to do your research your own. Do not let others or agents or consultants decide that which country you should choose or which medical university you should choose. Do your research on your own and check the authenticated website of the medical university wherein you would like to take your admission, because in that website you will get 100% genuine and authenticated information about the tuition fee, about the application cost, about the registration fee, about the hostel fee, and other things as well, because some universities may not have their own hostels or may not have their own hospitals. So all such kind of information you can easily get available on the university website itself. Just do not consider any other agents or consultants wherein they would tell you something else rather than the actual budget. So finally, I would like to say that there is no harm in choosing a medical university in abroad, because in abroad you will have multiple options and you just need to focus on which country or which medical university you are taking admission. You should check the pass percentage of that medical university. You should check the students' reviews who are studying in that university. You should also talk with the students or the faculties who are studying in that university or who are giving lectures in that university. So that will be very helpful in deciding which country or which medical university you should choose if you are going abroad for your medical studies. And if you're looking for more genuine information about any of the country you want to take admission in abroad, please feel free to contact us on the contact number given below. You can also comment down there if you want to know any specific details about any country or medical university. We would like to give you guidance on such medical university and countries, and we'll try to give you the most genuine information. And thank you so much. I hope you like this information. Please do like, share and subscribe my YouTube channel Eklavya Overseas.